what we've realized as time has gone on is that the sagittal or the sideways profile of the spine is really more important for the spine's function. So the spine has reciprocal curves. Your low back has a curve to the front, your thoracic spine has a curve to the back, and you make like a big S. And it's really the way that S balances itself out affects how we function in terms of our spine function. And Harrington instrumentation flattened that S because you're stretching everything out, made the spine very flat. And that, in the long run, when people got older, didn't function very well. So what you have is these adolescent kids who have scoliosis surgery, and after surgery, they're straighter, they're a little taller, but they don't, and they can compensate for the flattening of their spine because the bottom of their spine is so very healthy that it can actually go where it needs to go to make them stand up straight. As we get older, we lose the flexibility of our low spine and the discs wear out and collapse a little bit. And then people end up with this postural problem where they can't stand up straight because their low spine can no longer compensate for the flattening that's occurred. And so we end up having to go back and redo their surgery because we need to help them stand up. So Harrington worked great for adolescents. It didn't work so very well for adults. And the long-term effect of having your spine fused in that position was not as nice or as good as we would have hoped. So now that we have this third generation technique, you can build those curves back into the spine because we fixed the spine all along the spine, so that now you can build the curve into the spine the way you'd like it, and so that even later on, if there's some degeneration, you've kind of got the spine in a better position, so you can compensate for that very well. So for lots of reasons, the third generation technique that we use now is advantageous. That most kids are in the hospital for 3 to 4 days after surgery. They go home. They don't have to wear a brace or a cast. By the time they come back to the office at their 6 weeks office visit, it's like they've never even had an operation. And by 3 months, I let them return to sports play, and they get on with the rest of their life, and most of the results are really very excellent. So, you go back from a year in bed, in a cast, away from your family, to 3 or 4 days in the hospital, and 3 months later, you're back to all your normal activities with a good long-term prognosis as an adult. And it's really a remarkable change that we've been able to see just in a couple of years.